Hi, Paul Silovsky here, physical therapist and owner of Rebound Physical Therapy. And today I want to talk to you about how physical therapy relieves lower back pain naturally. Listen, here's the situation. 80% of people in America will have an episode of low back pain in their lifetime. And, some of those are time loss. Matter of fact, as far as time loss injuries, low back pain or neck and back pain for sure are the number 2 cause of lost time at work beyond the common cold and flu, right? So it's a very costly epidemic, if you will, in this society. And with low back pain, people treat it in a number of ways. There's a lot of money spent on drugs and injections and surgeries, sometimes unnecessarily if you haven't done the remedial things, which, one of the rudimentary things would be taking a therapeutic or corrective approach with physical therapy and the manual therapies that we can provide. But more on that later. Listen, there's many causes of low back pain. They can kind of be categorized into major areas like mechanical low back pain. That's the bulging or herniated discs, where you have the cushions in between the 2 vertebrae, almost like a jelly donut. The disc bulges out and presses on nerves, causes low back pain. That's one very generic way of describing mechanical low back pain. There's the problems that occur with the smaller joints that get people to say my back's out or it's caught, or there's a malalignment along with muscle strains or sprains. The more common thing, you go out and work in the yard, or you go get a sports injury, something like that, and you get a momentary or a short-term problem with your back with the muscles or ligaments. Those are all mechanical in nature. Then there are structural things. There's for sure things that happen structurally in the spine, like a scoliosis, a curvature of the spine. There's other deformities that you have from birth where things are out of alignment, where one vertebrae slides forward on another, and it's been that way for a very, very long time. There's other structural type things like that. And then there's inflammatory conditions, right? Like rheumatoid arthritis, other inflammatory conditions too that affect the spine and really cause a lot of mechanical problems. Most things result though in a mechanical malformation or dysfunction, if you will, of the low back or of the spine. And when it comes to physical therapy, we're able to treat those conditions, with corrective exercise, which is different than just exercising, right? But finding the right movements and the right patterns of movement that will restore more normal, optimum function of the spine. Because let's face it, if you've got a structural problem, mechanical problem, or inflammatory problem, nothing is going to become injured by putting you into more normal alignment and getting you moving into and through more optimal patterns for you to function in life. So oftentimes we'll see people with mechanical or structural back pain problems where we have to get the muscles in balance, both strength-wise and flexibility-wise, as well as incorrect movement patterns. If someone works on a repetitive motion, or they're in a poor bent forward posture at their desk, they're improperly fitted at their desk, and they've spent many hours or years, many years and hours moving incorrectly or getting into a non-optimal posture. They can't figure out why the right side of the low back's hurting, right? But they don't even know that they're fixed in this condition. They've got it's like an accordion. They got a compressive injury, a structural and mechanical reason for their back pain, and we don't necessarily 100% correct it. We don't have to, I guess is what I'm saying, but we improve the conditions so that there's less pressure on the nerves, the tissues become relaxed, the muscles in greater balance and alignment through corrective exercise, through manual therapies, which we're very good at. We're good at getting in and releasing tight tissues and stretching out structures that need to be lengthened, and then strengthening the ones that have been on a leave of absence for a period of time. They've been freeloading, if you will, and get the body in greater balance, and voila, the pain really reduces and goes away naturally. No drugs, no surgery, no injections. We just get the body functioning optimally through manual therapies, corrective exercise, movement re-education, home exercise instruction, and sometimes in that inflammatory stage, we do have to do modalities. We can use laser, ultrasound, heat and ice, teach you how to do that so that you can reduce your symptoms and maximize your back's function, because it can be done naturally. You need a proper evaluation to do that. I didn't even mention that in the beginning, but it's really critical that we do a thorough evaluation of your functional and your structural alignment, how you're moving, how you're positioned, and the things you're doing throughout the day to aggravate the back. Because regardless of whether it's a mechanical, inflammatory, or structural problem, we need to get you upright, moving right, and taking care of yourself. So give us a call at Rebound, 785-271-5533. We're happy to do a free screening to figure out how physical therapy can help you heal your back pain naturally, or if you need treatment and you already know that, give us a call. We're happy to help.